Hello again, everyone, and welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. A good topic today? Let's do it. Doctors who have had a patient that had such little common sense that you're surprised they made it as long as they have. What happened? Please remember to like, share, and subscribe. I'm friends with a nutritionist at a hospital. One of the stories that stuck with me was about a mid-30s construction worker who just collapsed one day. His co-workers called an ambulance and he rushed to the hospital, right? Well, they discovered he's nutrient deficient, like in everything. So my friend is called in and she's asking him about his diet. Well, I don't like eating breakfast and I don't like eating, then going back to work, so I don't eat lunch. And then I get home and the wife has to make dinner, so I start drinking beer. And by the time dinner is ready, I don't want to eat. Just have some more beer and go to bed. The dude was living off nothing but beer. He couldn't remember the last time he actually ate something. I had a patient come to me in emotional distress. He was afraid because he'd found a box of dirty, used syringes on the street and used them to shoot up. Well, he didn't know what he had contracted. I gave him reassurance and told him we would figure out what to do no matter what the test results were. And remarkably, he came back negative for everything. It was such a relief. On the same visit, when I gave him his results, I recommended that he get a tetanus shot. He looked me in the eye and refused, because vaccines are dangerous and kill people. It was hard to remain professional at that moment. I worked in a physical rehab hospital and would witness this conversation between the doctor and a newly admitted patient. Do you know what caused your stroke? Well, the hospital told me it was because I have high blood pressure, but I don't anymore. The high blood pressure medication cured it, and so I stopped taking it. Didn't your primary care tell you that you had to keep taking your medication? Yeah, but you know how doctors are. They get kickbacks from the drug companies for keeping us on shit we don't need. I got news for you. High blood pressure caused your stroke. You're lucky you didn't die. You are now back on your medication, and if you go off it again, you will die. Here's the report of your blood pressure when you were admitted to the hospital. Damn, that's high. It was never that high before. It got that high because you stopped taking your medication. That's one of the side effects of stopping cold turkey. Don't do it again. Some would get the message. A couple would say they were never going off their medication again because my spouse would kill me. A few would come back even more debilitated from another stroke because they did it again. Others, we'd hear, had another stroke and died. My mom once had a patient who was an old lady who was rushed to the ER after ingesting bug spray. After they managed to get her into a stable condition and had her admitted to a ward a few days later, Mom asked her why she did it. Her response? I accidentally swallowed a cockroach, so I swallowed the bug spray to kill the cockroach. I have so many stories as a semi-doctor dentist, but a striking case just a few weeks ago was a 40-something fellow who wondered why all of his teeth suddenly started to hurt all of the time. We talk a bit. Coincidentally, he mentions that his acid reflux has been acting up a little, but that wasn't a big concern for him. P.S. A little bit to him meant walking around for hours at night to settle his stomach if he ate too late. It turns out this dude had started drinking 6 liters of seltzer water a day to try and lose weight. 6 liters every day. Yeah, buddy. Your GI tract is basically acid bubbles at this point. Your teeth are melting, and your stomach is frothing over. Give your body a break and have some regular water from time to time. Paramedic. An elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole process of getting a medical history, vitals, and more detail on symptoms. Ask her what she had to drink today. A cup of tea 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Where do I start? Diabetic patient who said their doctor told them that their blood sugar needs to be around 250. Like hell the doctor said that. A guy with IBS, constipation, and bouts of explosive diarrhea did not understand why eating fast food for every meal was bad. There's lettuce and tomato on burgers, and potatoes are a vegetable. He would not change his diet and then got mad that his IBS wasn't getting better. Lotion bathing, not actually showering or bathing, but bathing by putting on lotion every day. I also didn't understand why we didn't recommend he stands in a stagnant lake in the middle of summer to soak his leg wounds. The same patient also refused to wash his hands. He also got blacklisted from all 4 hospital systems in the area for indecent exposure and verbally threatening staff. He could be seen in the ED, but that's it. Another patient said his doctor told him he couldn't shower or bathe. Said doctor came in and told him to shower and or take a bath. The patient still wasn't sure. Milk made lactose intolerant symptoms better for a bit. Patient was sure their child was having an allergic reaction to Benadryl when, in fact, the child was crying because they were woken up by said parent at 3 a.m. who wanted to watch TV at a loud volume and got super cranky, as would I. I gave the Benadryl at midnight. The last one had osteomyelitis, a bone infection, in a toe and needed it amputated. I went for a second opinion, which is okay, and got told the same thing. But then I wanted to know what the naturopath thought. He decided to use a healing mat, not sure what they're called, and ended up needing emergency surgery and losing his entire leg below the knee. As a paramedic, I received a call for difficulty breathing. I arrived on scene to find a 52-year-old female sitting in her living room. She told me she could only breathe through one side of her nose when she woke up this morning. It is now 6 a.m. She could breathe out of both sides just fine when she went to bed last night. She demanded to be transported to the ER to find out why this one side was not working right. I'm an optometrist in the US and have a couple of memorable ones. I had an argument with one patient who insisted that there were great healing benefits to using urine eye drops. Ugh. When asked about how she got these urine eye drops, she admitted to taking them directly from the toilet. And putting them straight into her eyes. My pleas for her to consider the risk of developing bacterial keratitis fell on deaf ears. I'm still dreading the day that one returns to the clinic with an infection. And if I had a nickel for every time a patient came to me 6 months after taking a severe blow to the eye and losing vision, only to find that they had a total retinal detachment, that they thought they could just walk off instead of seeking care, I would have 2 nickels, which is a lot, but it's weird that it happened twice in the 3 years I've been practicing. That's pretty disgusting and disturbing, and I wonder where some people hear some stuff, but, wow, gross. A medical social worker is here. I had a patient who discovered a full prescription that someone dropped in the Walmart parking lot. As he enjoyed taking drugs, he swallowed an entire bottle of blood pressure medication and wound up passing out in the middle of crossing the street and almost getting crushed to death. I talked to him about how maybe that wasn't the brightest idea. He said he just wondered what they would do, and I could tell that he'd do it again. He probably went right back to Walmart, hoping to score again. I had a patient come to the ER via an ambulance. I got checked in, and she asked how long the wait was for her nonsensical issue. The nurse told her to wait 30 plus minutes. This woman called another ambulance to take her to another hospital 20 minutes away that had a shorter wait time. I was blown away. Not only at the audacity, but also that the other ambulance agreed to take her. It became an office joke. Who's driving to lunch? Take an ambulance. Pharmacist here. Technically a doctor of pharmacy. You would be shocked at the number of people that go to me instead of urgent care or the ED. I had a patient who essentially hugged a wood stove by falling into it. He had just a huge 2nd or 3rd degree burn wrapping around his torso, which he said didn't hurt at all. He came into my pharmacy looking for burn cream. It took some convincing to get him to go to the hospital. I had another patient who was on Eliquis who had a deep stab wound in his calf. He was bleeding pretty well, and he wouldn't wait for an ambulance. He just wanted me to bind it and send him on his way. I had a 3rd look for Neosporin after a wild animal bit them, despite me telling them rabies wasn't something to F around with and that it was a 100% death sentence if you don't get the vaccine. She wasn't convinced. It took someone else chiming in who overheard the conversation agreeing with me, who had gone through something similar, to finally get the person to go. Then I showed my staff this video to demonstrate how horrific rabies is. I used to work at a health food store, and people sure would treat me like a doctor. I had to say out loud multiple times a day, "I'm not a doctor. Please consult a doctor about this." One time a woman wanted to treat her diabetes with just cinnamon. I could not convince her that I did not know anything about the health benefits of cinnamon or the complexities of diabetes. One time a man came in severely limping due to literal open sores all over his legs. I'm pretty sure I was unable to correct the look of horror on my face before he saw it, and I stammered out, "Sir, can I help you?" Like I actually meant, "Sir, can I call you an ambulance?" And he said, "Nope, just here for some aloe." I bought the damn aloe and left. He looked like he had been in a motorcycle wreck while wearing shorts. Another practically held me hostage to ask me about the natural lubes and how he was looking for an alternative to coconut oil, repeatedly saying it was just had a good glide while holding aggressive eye contact. I'll never forget these people for as long as I live. I had a patient who had no disabilities and no debilitating heart or lung disease. She lived in a 3-story house, but only used the ground floor because she didn't want to climb the stairs. She slept in the living room because she didn't feel like ambulating to the bedroom. She said she hadn't climbed a flight of stairs in at least 15 years because she didn't want to. And she used a scooter whenever she went out because why would I walk when I don't technically have to? She literally avoided anything that required physical exertion, and it was purely out of laziness. I've never met another patient like that. As a pediatrician, I do lots of things every day. But also, I have so much empathy because when it comes to your kids, of course, you're going to worry, and logic goes out the window. Lots of ED visits for fever of 99 Fahrenheit that improve with Tylenol, and the family waits 3 hours for me to see their healthy kid. It makes me sad that they spent their time that way, and that they were so stressed during that time. More egregious examples are the naturopathic parents, not even anti-vaccinators, but the ones whose kids have horrific chronic illnesses such as IBD or lupus and refuse to give them Western medicine. It's enraging. Their children suffer, are in pain, and, in many cases, have suffered irreversible damage because the parents want them to drink baking soda instead of receiving life-saving medications for their systemic illnesses. Jehovah's Witnesses irk me in a similar way, especially when their babies have serious congenital anomalies, and they refuse the life-saving surgery initially unless it's bloodless, which is an entire other illogical conversation to have anyway. A dialysis patient on fluid restriction comes in with severe volume overload. When asked how much water he drinks, he insists he's only drinking 8 ounces a day. The nurse pressed him a little more, and he admitted to drinking a gallon of milk a day, exceeding his 64 ounce of fluids a day. He didn't realize milk counted as a fluid. Vet here. I had this lady bring in her female cat who turned out to be pregnant. She was adamant that it was impossible, as this was strictly an indoor cat. Upon further questioning, she admitted that there was an inact Tom also living in the same house, but that he couldn't possibly have done it because he was the female cat's brother. Yeah, cats don't work that way. I once had a patient with a cancer diagnosis who was completely depressed about not being able to see their family anymore. I was confused because I had spoken with this individual's spouse and extended family who seemed supportive. There wasn't any indication of family problems, etc. It turns out that this individual thought genetic and family history had meant something similar to contagious, leading them to the conclusion that one should stay away from loved ones lest it be spread through the family. That was one clarification I was so happy to give. My podiatrist buddy told me this one. Lady has to have her foot amputated and is given waiver forms to sign pre-op. Buddy asks if she needs time to think about it. She's very nonchalant and doesn't seem to care much about what they do. He gets suspicious and probes a bit as to why she's not more concerned. She says she gets that way that they have to operate, and it's okay because the foot will grow back. He then has to explain that she's not a salamander. Things get a bit more serious. One of my professors told me this story from when we was treating patients in a women's clinic. Apparently, his woman was previously prescribed birth control pills but still kept getting pregnant. She complained that she took her birth control every night and didn't know why it wasn't working. Finally, my professor found out that she wasn't actually swallowing the birth control pills. She put the pills in her vagina and thought that's how birth control pills work. No one ever thought that they had to actually explain to her how to take birth control. My ex-girlfriend had a severe peanut allergy, and one time she ate a Thai chicken pizza in college cafeteria that did not list peanuts as one of the ingredients. After her throat started burning, she knew something was wrong, so she grabbed a glass of milk, which I guess helped a bit, and went outside for some air because she was having trouble breathing. A female security guard was passing outside in front of the building and saw that she might need some help. At this point, my ex was looking through her bag for her EpiPen. The security guard asked what was wrong, and she tried to explain that she had a severe peanut allergy and needed to be taken to the hospital. When the security guard saw her take out the EpiPen, she took it from her and said that it was school policy that she be the one to do it. She then asked my ex to hold out her arm so she could inject her. My girlfriend could not believe that the security guard was trying to inject her arm like it was a flu shot, and out of frustration, she yanked it from the guard's hand and put it in her thigh like you're supposed to, and sternly told her, "I need to get to the hospital now."